Bismillahirrahmanirrahim. Assalamu alaikum and hi to everybody. My name is Kashif Anwer and currently I'm working as HOD cardiac anesthesia in Peshawar Institute of Cardiology in Peshawar. I had more than 30 years of experience in anesthesia with most of them included cardiac anesthesia and intensive care. I did my graduation from Khyber Medical College and did my fellowship from College of Anaesthetists, Ireland. I moved back to Pakistan in 2012 and started cardiac anesthesia in one of the private institute in Peshawar, and after 10 years of spending there, I moved to Peshawar Institute of Cardiology. I headed the department of anesthesia in the private institute, and I'm heading the department here as well. As you all know, cardiac anesthesia is a subspecialty of anesthesia, which is rapidly expanding in Pakistan at a great pace. Today, I'm just going to outline the basic modules of cardiac anesthesia, which we perform during the procedures, and at a later stage, we will be discussing the topics individually, because there are too many topics that can be brought under one umbrella in one sitting. So we will be having more sessions on that. But today I just wanted to highlight few things about cardiac anesthesia, as it is a rapidly expanding specialty and people are scared of coming into cardiac anesthesia because of the technicalities and difficulties which they faces in cardiac anesthesia. So as for all of the anesthesia specialties, cardiac anesthesia is a multidisciplinary approach to a patient, which involves, as you all know, once the patient has a cardiac problems, there are problems with the end organs as well because of the low outputs and decreased contractilities. So most of the organs are hit. So in cardiac anesthesia, you have to be very vigilant and as compared to the rest of the anesthesia. In cardiac anesthesia, we have a pre-op status and intraoperative and then the post-operative care, which includes intensive care. Pre-operative, as for all of the anesthesia, the pre-operative care include a thorough pre-operative assessment of all of the organs of the body, with special emphasis on the cardiovascular respiratory system as well as the renal system as well, as these organs are hit by when the patients go on a bypass and because of the artificial flow nature of the blood, these organs are usually damaged bypass heart-lung bypass machine. So an intensive and thorough assessment of these organisms, which include your clinical assessment, your laboratory-based assessment, and then we have to come to the optimization of these organs. The surgeons are usually only involved in the surgical procedure, and because these patients go to the intensive care, which is also headed by in most of the places by the anesthesia department, therefore you will be looking after those patients' other organs as well. There are all the baseline investigations are carried out in these patients as per anesthesia requirement, but we have to do some specific cardiovascular and renal investigation along with that of the pulmonary functions test as well. So these are mandatory for any of the cardiac patient. Once we have a stabilized patient who is fit for the surgery after all those investigations, we come to the intraoperative, which is a very challenging job in cardiac anesthesia because these patients are not fittest of the patient. They usually ranges from ASA 3. At the most, they will be ASA 2, but most of them will be ASA 3 to ASA 4. So you have to be very vigilant while conducting your anesthesia. Same for all the procedure, IV line, airway management are the most important things for these patients, and induction should be done very carefully. Different modes of inductions are available. Narcotic based is most commonly used, which we are using in PIC as well. I used to use etomidate, which was very good for these sort of a patient. Unfortunately, it's no more available in Pakistan. And along with that, you can use benzodiazepines. So whatever you use, you have to be very careful with their induction agents and titrate it according to the patient requirement. Intubation should be very deep intubation so that you can minimize your laryngeal stimulus, which can cause severe tachycardia and increase your cardiac output, which is usually harmful to these patients. Maintenance, normally isoflurane is the inhalation agent drug of choice, which you use it. Fluids requirement should be very calculated, very methodically, because a little bit of the fluid can put your patient into a into a pulmonary edema very quickly. So you have to be careful, and you try to use a balanced fluid solution, which are some of them are available in the market, and you can use those ones as well. Then we come to the monitoring. This is normally the basic monitoring like saturation, ECG, and end-tidal carbon dioxide are the mandatory monitoring. Along with that, we use invasive monitoring like invasive arterial pressure monitoring to monitor the beat-to-beat variation in the blood pressure, along with that of the CVP and the temperature monitoring and urine output. They should be regulated and maintained throughout the procedure. In the middle of after patient gets a sternotomy, the patient goes on a bypass and the patient is put on a heart-lung bypass machine from where the perfusion takes over, but it's a duty of the anesthetist to look over your perfusionist as well. The procedure lasts for about 4 hours, minimum 4 hours. It takes about 4 hours, during which time the patient is cooled down to 28 to 30 degrees. So once they are coming off the bypass, rewarming starts, and once they are off bypass, you will face the complications of hypothermia as well as complication of that of the reperfusion injury. So you have to look after that. At the end of the procedure, the patient is usually always transferred to ICU, monitored throughout the way, and then they are managed in ICU. In ICU, the basic goals are to maintain normothermia, normal blood pressure, avoid hypoxia, and pain management. This is a short introduction of the cardiac anesthesia, and in the near future I'll be coming up with each topic individually so we can discuss each and individual topic in detail, so that will help the students learning of the cardiac anesthesia. Thank you very much.